Joining us now, former FDA Commissioner Dr. Scott Gottlieb. He's also on the board of Pfizer, which is in the race to produce a coronavirus vaccine. Dr. Gottlieb, very good to have you back on the show.
Thanks.
Can you bring us up to date on the latest that we know on how coronavirus is spread, what we know in terms of how it actually transmits from human to human, but also from surfaces and other places to humans? Has our information developed and become more fine-tuned? Is there an update?
Well, I don't think the recommendations or the guidance has really changed. There was that report that CDC put out that said that most of the transmissions from human to human, and we knew that. We knew most of the transmission is respiratory droplets, human to human, and we know that most of the settings in which people contract COVID is where they have sustained contact with another person who's infected. But that doesn't mean that there still isn't some transfer on contaminated surfaces. So the report from CDC got portrayed as the CDC saying that the spread is really human to human and through respiratory droplets. It didn't really say that. It just said most of the spread is through human contact, and we know that. And so we should still be vigilant about shared surfaces in places where you have a lot of people coming in physical contact with the same surface. So, for example, think of mass transit. I think it's very prudent that cities put in place guidelines and measures to try to clean shared surfaces and businesses as well, because there could still be spread through those surfaces, just less spread through those surfaces.
So, Doctor, this weekend, obviously Memorial Day weekend, a lot of people are going to be going out to the beaches if they can. Many people are going to be going into restaurants. Based on the science, based on what we've learned over the past 2 or 3 months, what are your recommendations on how they do that safely?
Well, look, we have a lot of information now that shows that when there's been outbreaks, when there's been clusters of infection, it's occurred primarily indoors. We have some studies out of China. There was just a study in a recent American Medical Journal on that as well, looking at cases where a single infection, a single introduction led to multiple infections. And most of those settings were indoor settings, many of them in the home or in mass transit. So doing things outside is safer. So, you know, my guidance to people and to municipalities, and I've been talking to a number of governors and mayors, is try to move as much as you can outdoors. So gym classes outside, if you're going to restart gym classes, if you're going to have religious services, try to hold them outside. Restaurants, as they reopen, should reopen outside. You know, municipalities should be changing local ordinances to make it easier for businesses to move business outdoors. We know there's less spread outside, not zero spread outside, just less spread. It becomes less efficient to transfer viruses with respiratory droplets in the outdoor air, in hot, humid air, and ultraviolet light. The sunshine does kill this virus. And so if you're outside, you're going to be lower risk than if you're indoors doing things.
Dr. Gottlieb, it's Willie Geist. As we move sort of chronologically through the summer, we had Dr. Zeke Emanuel here yesterday. He's been very conservative in terms of how quickly people should go back into businesses and into their lives. And he said effectively he thought summer camps should reopen, obviously in a modified sense. They're going to have all their protocols in place. It'll be different than summer camp has ever been before. But he thought summer camps should open. He thought that would be a good test to start looking at schools come August and September. What's your view about summer camps?
Well, look, I think there is going to be a seasonal effect here, and I think we're going to see transmission start to break off as we get into the depth of the summer, really July and August. And we saw that in 2009 with H1N1, and it came back in the fall. I think we face a lot of risk in the fall of a resurgence in infection, and we can't become too complacent in the summer. With respect to the camps, I had thought the camps would open. I thought they could open, particularly sleepaway camp, where you can create a protective bubble around children. I think what really tipped the equation on that and changed people's minds, and I was talking to some of the camp directors, was the reports of the incidence of this post-viral syndrome, what appears to be some kind of immune-mediated inflammatory syndrome that seems to be a post-viral syndrome in a small number of kids. There were about 100 cases in New York, more now. There were cases reported in the UK and Italy as well. We don't know the denominator. We don't know how many kids actually became infected, but we now see these cases. It's deeply concerning. And I think that changed the equation. I think that showed that there's probably more risk to children than we perceived previously. And I think that tipped the balance in terms of whether or not camps open this summer. And you're seeing a lot of camps make the decision now not to open.
So if a camp came to you, Dr. Gottlieb, I don't want to put you on the spot, and obviously this isn't formal advice, but just talking here, the camp came to you and said, we're a sleepaway camp, we think we can open, what would you say to them?
I think there's a possibility that you can create a protective bubble. So you think about, you bring the counselors on campus first, you test them all on, you keep them there, you can quarantine them for 2 weeks, then you bring the campers on, you can test them as they come in. You need to bring testing into the camp. I mean, I think if you could do those things, you can create a protective bubble around the kids. Remember, these kids are going to be out and about in the summer anyway, so there's going to be risk through their normal activities. It's not like they're risk-free at home. And so there might even be the potential to create a safer environment potentially in a sleepaway camp where you can create a bubble around the kids. Nobody comes in, nobody goes out. No visiting day this year. A lot of camps made the decision not to do that. I think part of the complexity for a lot of camps was bringing the testing in and being able to put those features in that would create that bubble. They just couldn't do it.
Of course, Willie, you are just asking that question for a friend, and of course,
two friends, actually.
My next question is going to be, what if you have a mother-in-law, or if somebody had a mother-in-law that comes over a lot? Anyway.
Well, actually,
I'm curious about the summer camp thing, too, because I've got 2 kids who very much still want to go to summer camp. So, but go ahead, Nick, I'm sorry.
So, Doctor, I mean, actually, these questions are so basic, but I think it would be incredible to hear from you on some of these basic things as the country tries to reopen without the testing that it needs. So, for example, if you're in an area that's been hit, even slightly, are we going to the dentist yet? If everyone is wearing proper PPE?
Yeah, look, I think we should try to do what we can in the summer, recognizing the fall could be a lot higher risk. So, you know, make your dental appointments, make your annual physical in August. I think we're going to see cases come down, transmission come down, notwithstanding the fact that we're reopening, and that's going to cause a surge in cases. And in fact, we've seen a pickup in hospitalizations in the last week. We expected that as we reopen. Hopefully, it's not going to be a big bump up. People are going to do this in a staged fashion. There's going to be a seasonal effect here. And so when we get into the summer, I'm hopeful that we can all take a little bit of a breather and try to do things that we've been putting off for a while. I think as we get into September and October, things can really pick up. In 2009, what you saw, if you look at the chart, and I put this out on Twitter a couple days ago, cases really collapsed in July and August. They were epidemic all the way into June, collapsed in July and August, and you saw them start to pick up in the last week in August, and then they really shot up in September and October. There's a risk that this is following a pattern like that where we're going to see a second wave. Now, hopefully we have in place the testing and we can detect those outbreaks going into the fall and implement interventions to try to contain the spread. But this spreads very easily. This is more contagious than the flu, and so it's going to be difficult to try to fully contain this heading into the fall.
So then you're saying at this point still hold off on going back to completely normal.
Wait, August seems to be the safest window.
Yeah, August, I think, is hopefully going to be the safest window if we want to be hopeful about the future. I think we should still continue to be, vigilant about what we do, still practice good hand hygiene, still wear a mask, still try to shrink down our social circles, try to limit, how much we do. There's been some studies that have come out that says if everyone goes shopping one time less per week, and you talked about the study out of CHOP, out of the University of Pennsylvania, and that's one of those studies, you can dramatically limit spread if people just, constrain their activity a little bit. So if we continue to do that on a mass scale, I think that's going to have an impact on the epidemiology of spread. But I think we hopefully will get a break this summer where we can take a little bit of a breather and do some of the things that we've been putting off for 2 or 3 months. A lot of people have put off health care that they need. This is the time to do it. I think we're going to be looking towards July and August. If there's elective things that you've put off, think about doing it now because there's going to be a lot of uncertainty, I think, after the summer passes.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.